into stores and getting the essentials that they need and washing their hands. Here it looks like Governor Pritzker is going ahead and issuing his statements. We're going to go ahead and turn it over to the governor.
And Dr. Ezike to discuss the latest update on the state of COVID-19 here in Illinois. First off, I want to address the guidance that we have offered regarding social distancing and event cancellations. I want to thank many of our residents who have taken these guidelines to heart. I know this is hard for everyone. That said, we saw a lot of crowds out and about today, and I need to be frank. We can have a massive positive effect on bending the transmission curve, thereby saving lives, if people will take this seriously. We have seen positive results in countries that took aggressive action, and we have seen tragic outcomes in countries that did not. If you are young and healthy, listen up. We need you to follow social distancing guidelines too. You may only have mild symptoms for a few days and may think that you're just fine, but you can have the unintended tragic effect of spreading COVID-19 to others who may be more vulnerable. Please, please do the right thing for your community, for your friends, and for your family. So once again, no matter how healthy you feel, if you can, stay home. If you are able to telework, do so. If you don't have to travel, don't. This isn't forever. This is a sacrifice in the short term to help our hospitals, our healthcare workers, our testing labs, and our vulnerable and elderly residents. Every action that we take to control the spread of this virus and prevent our medical infrastructure from dealing with too many cases at once is an action that saves lives. Every day that we follow social distancing protocols, we save lives. I also want to take a moment to lay out what a person should do if they think that they might have COVID-19. Our Department of Public Health is working around the clock to make sure that providers statewide have all the latest procedural guidance. But I want to make sure that all our residents know what to do and what to expect if they or a loved one thinks that they might be sick. Step one, call a healthcare provider. Don't just show up. Call first. That can be your primary care physician, a health clinic, or an emergency department. But please do not walk directly into an emergency room unless your condition is of a dire nature. The doctor will ask on the phone about your symptoms and if you have recently traveled, as well as talk about other potential exposures. If the healthcare provider thinks that you need medical care, and not everyone with COVID-19 will need medical care, they will help make arrangements for you to seek medical treatment in person so that the risk of exposing others, including people in the waiting room and healthcare providers, is reduced. At that point, healthcare providers will isolate you for further assessment. If you meet certain criteria, a physician may test for COVID-19, but we are prioritizing those with severe illness and those at higher incidence of complications, such as those with weakened immune systems, older adults, and those with medical conditions such as heart and lung disease. Public health officials are working expeditiously to identify all close contacts of cases and follow up with individuals who test positive. Again, not everyone who wants a test is going to need a test. People whose symptoms are mild, and that will be most people, will be able to isolate at home during their illness and will be asked to do so. I know that all of these asks are difficult personally and financially for some of our residents more than others. And I'm doing everything that I can to help our working families through these unprecedented challenges. With the federal government's newly declared state of emergency, Under the Stafford Act, my administration is filing a request for a federal waiver to allow our Medicaid program to more freely respond to the COVID-19 crisis by expanding medical services. During this crisis, my administration is working to ensure that those who fear that they may be getting sick will have access to the testing and treatment that they need without being saddled with costly medical bills for their care. When the federal waiver is approved, we'll be able to expand Medicaid services to fight this epidemic through the addition of new medical providers, increased access across the state, and ramped up services to many of the state's most vulnerable populations. I want to provide an update, finally, on the number of cases here in Illinois. Yesterday, we announced a total case count of 46, including individuals who have made a full recovery. Today, we have an additional 18 cases, bringing our total count to 64. While the majority of our cases remain concentrated in Cook County, our patients now span 8 counties of Illinois, including central and southern Illinois. In addition to Cook, Kane, McHenry, and Lake, those are Cumberland, DuPage, St. Clair, and Woodford counties. One of these cases is a woman in her 60s who resides at a private long-term care facility in DuPage County. I want to assure the public that members of my administration, including an infectious disease team from the Illinois Department of Public Health, are on the ground working with area officials. The facility has been locked down to outside visitors and internally, and we are monitoring every resident's health carefully with a heightened vigilance to minimize any further spread. As a reminder to our elderly residents and to their loved ones, we've issued strict guidelines around restricting visitors at long-term care facilities that we control, and we continue to collaborate with the various statewide associations to ensure that they are following our efforts with similarly strict guidelines across other facilities. Thank you very much, and as a reminder, we'll be back here tomorrow on Sunday at 2:30 p.m. unless otherwise noted, available live on our Facebook page and at illinois.gov/live video. Now I'd like to turn it over to our Director of the Department of Public Health, Dr. Ngozi Ezike.
Thank you so much, Governor. Just want to say that I'm really grateful to be part of this team led by Governor Pritzker. We're working tirelessly following his lead to be transparent and make sure we get all the information to all the stakeholders that need to have it. So we're working day and night and making sure that everyone gets all the information you need. So thank you for your leadership. As the Governor already mentioned, there are currently 64 confirmed cases of COVID-19 here in Illinois, including the initial cases, the first cases for both central and southern Illinois. Public health officials are working with the long-term care facility to identify all contacts of the new DuPage County woman in her 60s who was residing in a long-term care facility who has just recently tested positive. We are identifying all close contacts to make sure that we protect the health and safety of all residents and staff at the facility. As we have mentioned before, the nursing home residents, elderly patients are top of mind, and so all efforts are being employed to make sure that we tend to that case in the hospital and also look out for all those who are also in that facility. Infection control measures are required for all nursing homes. Additional vigilance for respiratory illness should be taken, as well as increased cleaning and visitor restrictions are to be implemented. And very fortunately, at this long-term care facility, all of those measures were taken up as we recommended them on Monday. They were immediately instituted. From what we've seen of this virus so far, older adults do tend to suffer more severe illness, and that's why our focus will be on these population. Younger adults and children may have only mild illness, but if they attend larger events or come in contact with vulnerable populations, people with certain health conditions, lung disease, weakened immune systems, that could cause the spread of the virus. It will take all of us working together to help reduce the spread of this virus. It will be stopped at the community level by canceling large events, staying home as much as possible, washing your hands and cleaning frequently touched surfaces, working from home whenever possible, and restricting visitors to long-term care facilities. These are tough sacrifices. We all have to make them. These steps will make a big difference. In addition to the cases that we saw in Cumberland, DuPage, St. Clair, and Woodford counties, cases were also identified in Chicago and suburban Cook, Kane, and Lake. We are seeing infection in all ages in Illinois, and you're seeing the spread throughout the state. Approximately 30% of the cases in Illinois are clearly travel associated. Another third are a contact of a known COVID case. And the remaining cases may not have a clear connection and therefore could be the result of community spread. Again, most of the people are either in isolation at home or in the hospital, and we've had several cases that have completely recovered and are out of isolation. At this time, there have been no deaths in Illinois related to COVID-19 cases. Yesterday, IDPH issued new guidance for healthcare providers to help them assess patients, take appropriate steps, and determine if testing is appropriate. Not everyone who requests a test needs a test. People who have symptoms and may need further assessment should start off by talking with their healthcare provider. It is not to call the hotline to get that specific one-on-one instruction. The hotline that the state set up is for the public who has general questions about coronavirus disease, rather than for healthcare providers who need to discuss diagnostic plans. To help physicians in this ever-changing landscape with updated guidelines and recommendations coming out almost daily, the state will be emailing IDPH guidance to all licensed providers in the state. Our guidance includes asking if the person, including healthcare workers, had close contact with a COVID-19 case, if there was travel from an affected geographic region, and that includes China, South Korea, Iran, Italy, and now most of Europe and Japan. If the person resides in a facility that has experienced clusters of infection that's not due to the flu, all those would be on the high priority list for getting tested for COVID-19. We are seeing a very high volume of testing at IDPH labs. Yesterday alone, we processed over 300 specimens. Total, our lab has processed approximately 1,600 specimens, representing over 800 people. While this is a growing number for us, we know that many more people are going to be and are requesting testing. We are starting to see laboratory results from commercial labs, which means we could see a dramatic increase in the number of positives over the coming days and weeks. Again, this is a very rapidly evolving situation, and we understand that people are very interested in being tested, and we're urging them to reach out to their healthcare provider to have that conversation. Individuals must go to a healthcare facility to have their specimens collected. We are working on more innovative strategies that are hopefully going to be rolled out soon. But at this time, you have to go to a healthcare facility and have your specimen collected, and then those specimens will be sent to the IDPH lab for testing. Guidance for this novel virus is changing day by day, sometimes hour by hour, and that's why we're here before you almost every day, to make sure that we update you. We want to urge people to stay home as much as possible, as the governor has pleaded, to reduce the number of people who will get sick. We don't want everyone to get sick at one time and overburden our healthcare system. I know that we have Spanish language outlets that are also covered, so I'm going to summarize my comments into Spanish. En este momento, hay 64 casos confirmados de COVID-19 en Illinois, incluso los primeros casos en el centro y el sur del estado. En el centro de Illinois, un residente del condado de Woodford de 70 años y un residente del condado de Cumberland de 70 años probaron positivo para el virus. En el sur de Illinois, un residente del condado de St. Clair de 60 años y una mujer de 70 años probaban positivo también. También estamos viendo resultados positivos en gente que están en riesgo de complicaciones médicas. Una mujer del condado DuPage de 60 años que reside en un asilo de ancianos ha dado positivo. Tenemos de trabajar juntos para ayudar a reducir este virus entre Illinois. El virus se detendrá a nivel comunitario, cancelando grandes eventos, quedando en casa cuando sea posible, lavándose las manos y limpiando lugares que se tocan con frecuencia, trabajando desde casa cuando sea posible y restringir a los visitantes a los asilos de ancianos. Además de los casos en los condados de Cumberland, DuPage, St. Clair y Woodford, también se identificaron casos en Chicago y los condados de los suburbios de Cook, Kane y Lake. Estamos viendo infecciones en gente de todas edades en Illinois. En este momento no hay muertes en Illinois conectado a los casos del virus. Queremos sugerir a las personas que se quedan en casa cuando sea posible para reducir la cantidad de personas que se pueden enfermar. Es importante limitar la carga de nuestro sistema de atención médica para los que están muy enfermos. Muchísimas gracias. And now I will turn it over to Director Ayala of the DuPage County Medical Health Department.
Thank you. Thank you and good afternoon. My name is Karen Ayala and I serve as the DuPage County Health Department Executive Director. First and foremost, I would like to thank Governor Pritzker, Director Dr. Ezike, and our County Board Chairman Dan Cronin, and the elected leadership across our country for their county for their continued support and leadership. The fact that we are announcing a case of COVID-19 in DuPage County is not surprising. At the DuPage County Health Department, our team has been working intently with our partners across the community for weeks to prepare and respond to this day. Responding to and monitoring disease outbreaks is one of the primary functions of public health, and we take this very seriously. Currently, the health department is in the process of contacting everyone that has been in close contact with the identified patient so that we can begin monitoring them to ensure they are healthy. Also, so they can be safely and quickly evaluated by medical professionals if the need arises. I am very grateful and pleased to announce that the long-term care facility was and has been prepared for this as well and began taking steps weeks ago and again on Monday, this past Monday, to minimize the spread of disease by not allowing visitors with any symptoms, and they continue their work and partnership with us. It's important to also note that there are no additional precautions for the general public to take, but to continue to follow the steps that we've been providing and the governor has been providing on a daily basis. Please stay home if you're sick. Avoid close contact with people who are sick. When you sneeze or cough, cover your mouth and nose with a tissue and throw the tissue in the trash. If you do have symptoms of COVID-19, a fever of 100.4 or higher, a cough and difficulty breathing, please, as the governor indicated, call your doctor to discuss your situation and your condition. In DuPage County, we will maintain our contact with our healthcare providers, our community partners, our first responders, the DuPage County Regional Office of Education and school superintendents, mayors and managers, as well as many other agencies throughout the county as our response to COVID-19 has developed. Additionally, there is COVID-19 information on our website at DuPageHealth.org/COVID-19. And DuPage County residents with questions or concerns, please check out our website to identify the COVID-19 hotline. Thank you. And now I would like to turn it over to my colleague, Dr. Arwady, for additional comments.
Good afternoon, everyone. Allison Arwady, I'm the Commissioner at the Chicago Department of Public Health. And really, I want to highlight, in addition to all of the public health work, following up on these cases, really making sure that we're working as hard as we can on every case. I want to highlight a lot of the other work that is happening to make sure that everyone has what they need to stay safe during this time period. So with so much news over the last few days, I know you are probably feeling overwhelmed and confused. You're wondering what you should do now. There is a time of some uncertainty. We have not been through anything quite like this before. You'll recall the governor announced yesterday that all Illinois schools will be closed from Tuesday, March 17 through Tuesday, March 30, and will reassess at that time. Mayor Lightfoot and the entire city team here in Chicago are taking the lead to ensure our children will be safe and engaged during this time. And I'm highlighting this because I know that there is similar work happening for school districts and in counties around the state. Here in Chicago, we have a lot of focus. We've exercised these plans before, and we have them in place to make sure that there will be meals for children in need. Families will be able to pick up a meal package with 3 days worth of meals at one time, Monday through Friday, 9 a.m. to 1 p.m., outside their neighborhood school. I'm not going to get into more details here. We provided some last night. But for Chicago Public Schools related updates, I'd like parents and families to visit cps.edu/coronavirus. And as always, for City of Chicago updates, chicago.gov/coronavirus. In addition here, just at a high level, we will be providing enrichment and care activities where needed at select Chicago Parks District facilities. There will be a list of those facilities online. Libraries will be open, and to prepare our parks and libraries to serve as safe centers for families impacted by the school closures. We've already started enhanced cleaning, and we'll be ready to go on Tuesday. The best choice is for students to be at home with their parents, with their guardians. But we know, for example, that we have healthcare workers working in the city of Chicago. We know that we have first responders. We know that we have people who work in public safety and other really critical infrastructure needs. And so for these and for the thousands of families who we know will need assistance in meeting these basic needs, we're making sure that we're standing up, as I know cities and counties are across the state. We're just learning what our new normal looks like as we protect ourselves and our community. I want to be clear that life does not stop altogether. We need to make sure that people are home as much as they can be. It is imperative that anyone who is sick stay home. No exceptions. You've heard us talk about vulnerable populations especially. People who are over 60, people who have underlying medical conditions. In those cases, we want folks home. If people need to go to the grocery store to get supplies, they should go to the grocery store to get supplies. But they need to be maintaining distance. They need to be washing hands. And we're really asking everybody in Chicago and really around the state, especially if you're in that younger, healthier group, to think about how, even now, when you're feeling scared and worried, how you can support our vulnerable populations. Older people, people with underlying conditions, and frankly, people who will have economic and social needs, and to make sure that together and safely we're meeting those needs. I'm not going to detail for time the excellent advice around the hand washing, the cover cough. That stands true and we need it in place. But I do want to just say that we still want people to make a plan to vote on Tuesday, March 17. If there is anything that the COVID-19 response has shown us, it's the critical importance of having dedicated, competent, and truthful people in leadership at all levels. We've talked about details. It's available on the website. But we need everybody stepping up, doing this safely, really making sure now is the time to listen, make changes, and make sure that we're all taking care of each other. I've been so proud of our response here in Chicago and in Illinois so far. We continue to actively work with all of our partners and with all of you. Chicago is as prepared, Illinois is as prepared as we can be for this. We're rolling out our plans, we're working on cases, we're going to continue to share information. So please, stay well, stay safe, stay calm. It's not a time for panic. It's a time for listening to the advice and learning more to make sure you're sharing good information. With that, I'm going to ask Governor Pritzker to come back up to take questions. Thank you.
Thank you, Doctor. Thank you. Just before I take questions, two things. First, I want to thank our partners all across the state. The county board chairman of DuPage County, Dan Cronin, who's been here several times already to join us. His health officials who are doing a terrific job. The city of Chicago and the 101 other counties other than DuPage, whose health officials are on alert and working hard on everybody's behalf. So I want to just express my gratitude. We're talking to people across the state, and everybody is ready and working hard. Second thing I want to say is just repeating something that Dr. Arwoody said. The polls will be open on Tuesday. Tuesday is Election Day. We hope everybody will get out to vote. If you have a mail ballot, you can put it in the mail now. It will be postmarked properly, and your vote will count. You can take it to your county clerk's office to deliver it. You can also vote at an early voting site in all across the state of Illinois. Every day is Election Day in Illinois right now. So today, tomorrow, Monday, we've had hours extended so that you can get there after hours. And then, of course, on Tuesday, the polls will be open if you like to vote on Election Day itself. So having said that, happy to take any questions from members of the media. Yes, sir. Yeah.
As you move closer to thinking about any kind of mandate on businesses, as far as restrictions on how long they're in operation or open, or if they're allowed to open at all, or anything?
Well, we of course talked, as you know, I talked directly with team owners. They're private business owners too, the people who run, the Bulls games and the White Sox and the Cubs and so on. And frankly, every private business owner that I've spoken with to talk about COVID-19, the challenges that we're facing, to ask them to make sacrifices, has been willing to step up to the plate. I am so proud of our business community in Illinois. Really, I can't say enough about that. You should all be proud too. I've talked to the utility companies. I've talked to food manufacturers in our state to make sure we have enough food for our kids on Tuesday and beyond when they're out of school in neighborhoods where they might not otherwise be able to access it, to make sure that people aren't having their electricity shut off if they can't pay because they might not be working over the next 2 weeks. So I just want you to know that the business community has been very cooperative so far. I have not looked at other business restrictions, that obviously when you talk about limiting crowds, 250 or less, and in some areas they've limited to even smaller numbers, that has an impact on businesses itself, but no further restrictions right now.
What about, you mentioned this when you were coming in, that you saw the crowds of people out on the street. I mean, while we were driving here, there's lines out the door for bars.
Yeah.
And people, I mean, given it's St. Patrick's Day weekend, I get that, but this message of social distancing seems to not be taking hold in some age groups. How is the state reaching out to these people? Because there are lines out there, and they're going to be there all night.
So I want to ask you for your help in this. I'm standing here, you heard me just moments ago talk about that exact problem. I see those same people on the street. The fact is that people need to act properly at this time. People and others should be talking to those people about acting properly. I have made it very clear that gathering in crowds is not a good idea. And of course we've mandated very large crowds not gather. So we're doing the best we can, but it is very helpful if members of the media will repeat this message for us. I think that there are young people who hear that, well, it's not affecting as many young people as it is older people, or it's not as impactful on young people, and they think, well, it's okay to just go on about their business the way they were before. That's just not true. You could be a carrier yourself. So when you go out in public, whether you're 20 years old, 30 years old, 15, when you go out in public, you are potentially giving somebody else COVID-19. So please go home. Please gather in smaller groups.
Just to follow
Yes.
up real quick, you mentioned that businesses have been very cooperative.
Yes.
Yet, again, you have bars that are open today that have, if not close to 200 people in them.
Yeah.
I mean, there's a lot of people in there. What about those businesses? I know in Italy they shut down all the bars and restaurants and everything like that. What can the state do, and are you looking at options?
Look, we're always looking at all the options here. I mean, you've seen that things have evolved here over the time that we've had just these daily press briefings. So we're always looking at all the options. But at the moment, we're asking people to do the right thing. And to your point, what I was referring to is all the business people that I've spoken with directly, called them. These are many people I didn't know before. Some I did, some I didn't. Every single one of them, though, has reacted positively. So I would suggest to you that your reportage of what I'm saying will help with small businesses, too. Look, we don't want to put people out of business, but we do want people to act properly in this moment to keep the public safe and healthy.
Governor, could you walk us
Sir.
through your decision not to close daycare facilities and libraries? Some
Sure.
other states, cities have made that decision.
Yeah. And again, states and counties and cities are can make further restrictions if they choose. But look, the guidance, as you know, that we gave is no gatherings of 250 people or more. And one of the reasons we closed the schools was it was difficult to know exactly how much interaction, in the hallways and so on, that 250, when would you reach a 250 sort of number in a large school, right? Thousands of kids sometimes in a school. So there are preschools that are in those K-12 facilities. Those are shut down too. But the independent child care and daycare and preschools, the ones that operate separate from K-12, typically are much smaller. And so because of that 250 rule, and because we're looking, at least at this moment, and again, we can evolve our guidance here, but at this moment, it does not look like we need to shut those down or ask people to close. And I think, it would additionally be a hardship given that the schools are closed. So those are remaining open, and again, those are smaller groups. You have to remember, we operate today on the scientific evidence that exists, which is somewhat limited because of the limit on the tests. You've heard me talk about this every day. I won't go on about it today, but we have a limit to the number of tests that we have currently. And so we have to operate a little bit on the basis of statisticians and mathematicians working with the scientists to determine what size crowds are okay and what size crowds are probably not okay. And those are estimates. We're operating on those estimates. Those are, again, made by experts. But that's why you see a number like 250 and not 200 or 150 or 50. Right now, the guidance is 250, and we're following that.
Governor, what
Yes, ma'am.
message do you have for the people that are going to these stores and panicking, buying supplies in bulk?
Well, I think Dr. Ayala had it right when she said there is no need to panic here. We have the supplies are here. We're making sure that stores are getting restocked. We're working on supply chain. We also know that those stores aren't going to close. We are in communication with not only food manufacturers but also with grocers to make sure that we're making it somewhat seamless, easier for them, looking at regulations that make it harder today to restock their shelves. We want to kind of lower the barriers at the moment for them during this crisis. And I think you'll see, look, the most popular items are going to be out of stock because people are grabbing every one of them that they can find. But typically the grocery stores are reasonably large. There are other food stocks that people can access, and we would just encourage them to do that. And also talk to the grocer about when the next time there might be a restocking.
Governor, can somebody detail again how you get COVID-19 and is it airborne?
Dr. Ezike? Thank you.
So we are worried about coughing and sneezing. That is what releases the droplets that can cause the infection. You could also, why we talk about coughing into your napkin and throwing that away, is that you could cough into your hand and have the germs, the virus in your hand touch a surface, then someone else could touch the surface, touch their mouth, their nose, their eye, and get the virus into their system that way. So we definitely are concerned about the droplets that are most easily transmitted through coughing and sneezing into the air, but also through touching, getting the virus from your mouth, from your nose, and then touching surfaces. That's why we're saying consistently consistently disinfect, frequently touch surfaces, because viruses can sit on surfaces for an unspecified amount of time, and then someone else could unknowingly touch, and then cause entry into the body.
Of
the 64 cases.
Yeah, potentially it could be a couple of hours. So we definitely want people to cover their cough. We're saying if you are coughing, stay at home. That's the best way to decrease spread to other people. And so it's really not something that we should be taking lightly. Anytime I come to, even these press conferences and you hear people coughing or sneezing, you're wondering, is this guidance really penetrating? It's really important that everyone follows that. We've said over and over that even if you might not be significantly sick and feel like you can go to work and don't have any impediment to going to work, you have to think beyond yourself and think about the person next to you who could get infected, who might not do as well should they fall ill.
Of the 64 cases, do we know how many have recovered or are in the process of recovering? I'm just curious if there's a number, percentage, or an estimate.
Yeah. So in the process, so most of them are in the process of recovering. So they're finishing, most of the people are finishing out their home isolation or even doing some isolation in the hospital. Our first two cases are out of the hospital, out of the isolation period. So again, most of our patients, just as we've seen the stats have borne out across the world, China having obviously the most data, most people do well. And so we are counting on that to be the same for our population here in the United States, having that keen eye on people who are older than 60 and have pre-existing conditions. Hemodialysis patients, liver patients. Also, pregnancy is considered one of these high-risk conditions. And then, heart conditions, high blood pressure, diabetes, any cancer patients, anybody on immunosuppressive medicines. All of those people are our higher-risk people, and so we have a special eye out for them as well.
What are the visitor restrictions to the healthcare facilities, and could that be seen statewide, or is it in the process of becoming statewide?
Yeah, so after we saw that starting to be the exponential increase of cases, I think...
In other places, not in Illinois, we haven't seen that.
Yeah.
In nursing.
So we and also following the example of Washington, so over the weekend, we spent all the weekend with our infection prevention specialists, our long-term care facility specialists, working the whole weekend trying to come up with stronger guidance to make sure that we had a special eye towards that special vulnerable population. And so on Monday, after putting the new guidelines together, we had a call. I think there were hundreds and hundreds of nursing home administrators on that call where we said, we really don't want visitors in your facilities. We want visitor restrictions. We made a few exceptions for people who are at the end of life, saying maybe one visitor for people who are already at the end of life. We wanted pre-shift assessments for all the staff. We don't want staff coming into the facility that are sick, that are recently came off of a cruise ship, recently came off a vacation from Europe. So we said we want pre-shift assessment to make sure that the people coming to work are safe to be working with our most vulnerable population. We said that even the vendors that come in, they need to be assessed to make sure that they're safe to be passing out or doing whatever activity that they're doing in the facility. So those more stringent guidelines were rolled out on Monday. Our affected long-term care facility was already practicing those measures, which we're very grateful for. And we want all long-term care facilities, our veterans' homes, to follow these guidelines, because people in these aggregate settings where they are in a place and other people are coming in and out, it's the people who are coming in and out who are their greatest risk. And so we want the people coming in and out to be healthy and not pose a threat to the people that they're there to care for.
When you were speaking,
that facility being tested now?
I'm sorry?
Are other people at that facility being tested now?
So we're following the appropriate protocols to identify people who have come in contact with the case. There's more vigilant, aggressive screening, like all residents are being checked and monitored and assessed every shift. So multiple times a day, they're checking to see if there's any change in any resident's condition. At the first sign of any change in symptoms, again, we know that our elderly, more infirmed patients can show sickness in different ways. So there'll be a broader brush. Sometimes elderly patients can't get to a fever of 101 or 100.4. So even if we see that normally your temperature was around 96, but now it's 98, for me, 98 is a normal temperature, but in that patient, when we see the trend and see that this is an increase, like that person would be considered appropriate for testing, because that would be considered an elevated temperature for them. So all of those more stringent guidelines are in place, and we have our team on site there. We have infectious disease consultant, we have long-term care facility experts, and we have teams at both the hospital and the facility to make sure that everybody's identified and cared for appropriately.
And I just want to add that actually a week ago, maybe more, we started having conversations with folks in other states, Washington State, for example, where we knew there had been challenges in nursing homes, because we wanted to get ahead of this and figure out what, the right thing to do was and what mistakes may have been made along the way, and to learn from that. And so that's why you hear so many precautions that have been activated around this particular nursing home as we have, the case that's been identified.
I know this is the federal government, but we've talked with several people that are coming back from Europe, Italy being one of the countries that people we talked to, and they said that when they came into O'Hare, there was nothing. I mean, they just went through customs as normal. They were asked no questions of where they were. I know this is the federal government, but they're also coming into Chicago. What is being done? Is there anything being done to start screening or have some sort of protocol for screening? Because we hear that there is, but it doesn't appear as if it's being practiced.
Yeah, so I'm going to turn this over to Dr. Arwady in a moment, because Chicago covers O'Hare, which is what you're talking about. I will say that there is identification going on at the airport, but it's not that people are being stopped necessarily if they don't have symptoms. But let me turn it over to Dr. Arwady.
Yeah, sure. Thank you, Governor. And I'll just add on the question about the transmission piece, just one additional piece. Agree with Dr. Ezike, but really highlighting where we're the most concerned for transmission is when there is this close contact, which again is 10 minutes within 6 feet, sort of close contact. And so a lot of the conversations that we're talking about social distancing, how does this fit in, is thinking about, avoiding those close contact type situations. So just adding on, I know there's a lot of information and a lot of pieces. To the airport piece, so certainly, you know, as you've heard me say, the Chicago Department of Public Health folks have been out at O'Hare really supporting that federal piece. And it is a federal decision in terms of what happens at the airport screening. We were and are concerned when travelers are not getting full information when they're returning. I know that the CDC screeners have actually expanded so that making sure that travelers who are returning from Europe now are receiving written information, really making sure that they understand what to watch for, what symptoms, some information about how to reach out if they have need. And I can tell you that in Chicago, we are also, and this has been high on our list in terms of if there are not things in place at that federal government level, having some conversations with airlines, really thinking about what else might we need to do to fill in any gaps that are there. So
I'm sorry.
No, that's okay. Please.
But it sounds like then it's almost more self-reporting for those people coming back in.
Yeah, so certainly there are still some travelers from the very high-risk areas, from China and Iran, are continuing to get individual level temperature checks, the full thing. With the expansion of this, frankly, you've heard me say it's difficult to quarantine the whole world. There has been additional at the federal level really working to make sure that travelers especially are getting information, right? That's what I'm most interested in. I think there is also some level of visual assessments. I'm not going to speak to that because that's not our protocol, that's not our piece, but we've been in touch, we are aware, and we're working to make sure that at least when folks are coming to Chicago, we want to make sure they're getting the good information.
Something like the phrase "stay home as much as possible" was uttered during this news conference.
Yes.
Is that new guidance? I don't recall hearing something like that.
We talked about it yesterday. I think what we're encouraging people to stay home this weekend. We're not saying that if you have to go to work, et cetera, right? And we're encouraging telework and other options. But I think people.
All right, everybody, you just heard a lot of information from the Governor Pritzker and the Illinois Department of Public Health. Just to go ahead and recap, because shortly we are expecting a press conference from the Peoria City County Department of Health and other leaders within Central Illinois. Governor Pritzker confirming that there are 18 new cases since yesterday, including one in Central Illinois. The Illinois Department of Public Health on his website saying that is a man in his 70s. In Woodford County. That's all we know at this point. We'll ask more information, obviously, within the health department presser that is coming up. A lot of information there when it comes to testing and what the state of Illinois wants people to do. If you are feeling any kind of symptoms, the governor says to call your primary doctor or health provider first. He says do not go directly to the ER. They are trying to make sure that they limit the amount of spread unnecessarily as possible. He says once you're able to talk to your health provider and you talk to that doctor, then they can look at your symptoms and recommend whether or not you should go to a health facility, where then a specimen will be taken so that it can be sent to testing. At this point, there are roughly 1,600 specimens that have been tested. They said that's about 800 people, with about 195 tests that are still pending at this point. I think right now we are ready to go to the Peoria City County Health Department press conference, where we should be getting more information about the local case, the first case reported in Central Illinois of COVID-19. Go ahead and take a listen.
Who is at our medical director for Peoria City County Health Department, followed by Dr. Knapp, Dr. Samir Sater, and then we'll have distinguished guests here as well to answer any questions from various leadership as well. This one? Watch out for it, or turn it on? Okay. Okay. During this meeting, after you speak, I'll come back with the questions. Good afternoon. I'm Monica Hendrickson. I am the administrator for the Peoria City County Health Department, and welcome to our Tri-County COVID press briefing. I'd like to welcome everyone and introduce Hillary Aggert, who is the administrator for the Woodford County Health Department.
Thank you, Monica. My name is Hillary Aggert with the Woodford County Health Department. As you probably are aware from the governor's press conference, that Woodford County does have a positive COVID-19 case. This individual was tested at a Unity Point Health Clinic in Central Illinois. Positive results were received late Friday, March 13th. Public health officials were notified immediately according to the state and local public health protocols. The individual is currently recovering at home and is in isolation. Woodford County health officials are working closely with Peoria and Tazewell counties, as well as the Illinois Department of Public Health. We are investigating and notifying any individuals who may have had exposure to the individual who tested positive. The case and safety of our residents is our highest priority. All partners organizing this effort remain fully prepared to respond to the COVID-19 cases. Public health and hospital systems maintain highly trained infectious control teams, specialized equipment, and protocols consistent with the latest guidance from the Center of Disease Control and Prevention. The Peoria region is taking steps to increase its testing capacity and will share new information on testing as soon as it becomes available. As the governor has stated, we are asking all residents that may have symptoms to stay at home and to call a healthcare provider. Again, to call a healthcare provider. Please do not rush to the emergency room, as we would like our systems in the healthcare world to remain open for those who are critically ill. I would like to also talk about residents and encourage you all to learn different steps of taking precautions. Make sure that you're limiting your access to one another, as we would like you to know that we are looking at those close proximities. That's why you see a lot of our sector population canceling large events. We want you to stay home when you are sick, avoid touching your eyes, nose, and mouth, and avoid the close proximity to anyone who has potential symptoms of illness in general. We would like you to clean and disinfect frequently and follow CDC recommendations for using any proper PPE or face masks and shields. Thank you for your time.
As administrator for Peoria City County Health Department, I think it's important to note that this is a regional approach. It's not one single health department that is working on this, but the fact that our Tri-County, that over the years has built a strong collaborative partnership and is committed to the public health and our safety. With that, joint information and messaging will be done through our Central Illinois Public Information Officers. And I would like to also make a note that, being that this is the first case that we've seen in our central region, this is why we are having this press conference. Moving forward, as cases increase, which we do have the expectation that they will, we will be releasing press briefings or utilizing the governor's statements on his daily briefings. So with that, I'd like to also introduce now Amy Fox, who is administrator for Tazewell County Health Department.
Thank you, Monica, and good afternoon. In accordance with Governor Pritzker's recent orders, we're no longer having large gatherings over 250 people. Another large gathering place, our places of worship, have been asking for guidance. Due to the increase of activity of coronavirus in the Tri-County, the local health departments are advising the use of teleservices or other social media where possible. Parishioners in the high-risk group, those 60+ years of age, or with chronic health conditions should stay home as much as possible. Stay approximately 6 feet from others and avoid all ill people. And again, if you are ill with fever, cough, shortness of breath, contact healthcare providers and stay home. Worship leaders are a key partner in helping to reduce the spread of COVID-19 in our community. As the governor said in his press release or press conference at 2:30 today, every action we take saves lives. I'd like to introduce Dr. Greg Stoner, who's the Medical Director of Peoria City County Health Department and the Chief Medical Officer of Heartland Health Services.
Thank you, Amy. It's been stated about social isolation, and that's one of the keys to this. But keep in mind that this is something that we really did expect. When you look at the global changes, when you look at the national changes, we knew that this day was going to come someday, and so it is today. The advice that has been given all along about when to seek medical care, the advice as far as hand washing and social isolation has been the right advice all along. And the recommendations as far as school closing and canceling the IHSA tournament and all the things that have been done locally in this community were really kind of a little bit ahead of the curve and done in a very timely manner. So we are all working together, both hospital systems and the health department, and the health departments of both Woodford and Tazewell County to work on this problem. So again, social isolation is the key, keeping that 6-foot distance. And you're really working to not just take care of yourself, but really to take care of the whole community. And that is each of our responsibilities. So thank you. I'd like to introduce Dr. Keith Knepp, the Regional CEO and President of Unity Point Health.
Thank you, Dr. Stoner. Thank you all for being here today. I'd like to start off by saying clearly to our community, we have all been preparing for this moment, as you heard. The fact that there's now a known case of COVID-19 in this region is not a surprise, given the global pandemic and the potential spread of this virus that we've known about for some time. With that said, it's imperative that we all work together and support each other to help minimize the spread of COVID-19 in the future, as you've already heard. Unity Point Health, along with other health systems, has had long-standing plans for the management of infectious diseases in general and for crisis management in general, and we have enhanced those plans for this situation in recent weeks and months. We're also continuously monitoring and implementing the latest guidance that's provided by the WHO, the CDC, and our state and local health departments. We've been operating our incident command center both at a regional and system level and feel confident in our approach to continue to manage the situation. We're also grateful for the recent release of restrictions by the federal government, which will help us in testing and in providing care. For anyone in the community who's ill and needs to seek medical care, we ask that you please call ahead to your primary care provider or other point of care to let them know ahead of time that you have signs and symptoms. We do have testing supplies. We don't have unlimited testing supplies and capacity. So we continue to apply an approach to determine how to best use those testing resources. And the best way for us to do that is for you to call ahead and make those plans and then follow the guidance that's provided. As of today, we are restricting visitors to our Unity Point hospitals and inpatient facilities to help the people that we're caring for, especially those that are most vulnerable. I'll take a moment to outline what those additional visitor restrictions are. We're not admitting any visitors unless they're determined to be critically essential to the patient's well-being. We know there are needed exceptions for that. Some of those exceptions would be end-of-life care, childbirth, and those situations when a patient's visitors are considered to be essential for the patient's well-being and care. And visitors allowed within our facilities must be healthy. We strongly recommend you don't visit if you're displaying signs or symptoms of an influenza-like illness, which includes a fever, cough, or sore throat. And if you show symptoms, you may be asked to leave. We do understand these restrictions may impose an inconvenience to some families, and we apologize for that. but it's an important step to keep everyone as safe and healthy as possible. So we ask for your support as we implement those. What we need now is the help of the community to ensure our healthcare resources will allow us to continue providing the best care possible. So I'm going to turn over the microphone to the Unity Point Health Chief Medical Officer, Dr. Samer Sater, and he's going to go through some of those items for you. Thank you.
Good afternoon. All the things that the health department and our leaders and elected leaders are doing right now are to reduce the number of cases that we get over a short period of time. The way that that occurs is by helping yourself, helping your family. That means social isolation. If you're ill, don't come out. If you are having a fever, chills, call your provider. Don't rush to the hospital. Don't rush to the emergency department. We are lucky in this community to have two great healthcare systems. We're lucky to have a great university, but those resources are limited. So we need you to take care of yourself at home, protect your family, and by doing those things, washing your hand, reducing the number of infections, don't spread any type of infection that you currently have, be it influenza or the COVID. That will help us save our resources for the people that need it the most. Monica?
Before we go into some questions from our press here, I do want to thank individuals from Unity Point leadership that have made themselves available, as well as Peoria City Mayor Artist, Peoria County Chairman Andrew Rand, Tazewell County Board Chairman David Zimmerman, and then Representative Ryan Spain, who's actually going to speak directly about the impact Woodford County has.
Well, good afternoon, and let me also recognize Councilman Sid Ruckriegel is here in the office of Congressman Darren LaHood. All of your local elected officials are mobilized and engaged as we respond to this urgent health situation. I think one of the things that as elected officials we're most grateful for is the strong healthcare delivery system that we have here in Central Illinois, and our outstanding leadership of our local county health department administrators. So Monica Hendrickson from Peoria, Amy Fox in Tazewell, and Hillary Eggert in Woodford County. Our hat is off to all of you. Thank you for your round-the-clock work and efforts, and we're here to support you and do anything that we can to make the resources and leadership of all of our communities available so that we can work together through this situation. I think that we would again urge all of our constituents, all of our residents to be calm. The Peoria area has one of the highest concentration of healthcare workers on a per capita basis anywhere in this country. Our region is well positioned to deliver and work through this period of difficulty, but it will require sacrifices from all of us as citizens. And so we're asking people to stay at home, to work from home if you can, to be smart and sensible, wash your hands, limit your distance and interaction with others. And again, if you are sick, we ask you to call your healthcare provider, call your doctor. We want to make sure that the engines of our hospitals are continuing to work on a finely tuned basis. And so recognize that we have the appropriate infrastructure to advise you if you are feeling ill or symptomatic, and that our hospital systems have engaged the right structure to provide the care and comfort for you. And it may require that you are spending some time at home, but this is a sacrifice that we will all be able to work through together. In addition, though, I know that we have a very generous community, and as we grapple with our new reality of businesses that are closed, and particularly school closures now that will begin next week, we understand that this will create challenges throughout our region. And so we have a very generous community. If you are an individual or an organization that is looking to help us through this period of transition, we're very grateful to receive your help. We will be utilizing our regional 211 system to accumulate information and provide collect offers for assistance for donations of both food, money, supplies that may be needed. And in addition, my legislative office will help coordinate any of those entities that need assistance. So if you're a local school district that is looking for assistance in delivering meals, or you're a community organization providing services to the elderly, please contact my legislative office, either by phone, which is 309-690-7373, or by email. My email is repryanspain@gmail.com. And we'll use our office as, at least for now, the clearinghouse for some of those information for how we can really harness the generosity of our community during this time. Monica, thank you for your leadership, and to all the elected officials here working through this important and urgent healthcare challenge.
I know our Unity Point partners were able to discuss what they have been doing, but we do have representation from OSF St. Francis Medical Center to speak what OSF is doing in our community as well.
Thank you, and good afternoon. My name is Michelle Conger, and I'm the Chief Strategy Officer for OSF Healthcare. I'm also the CEO for OSF's Digital Health Center. I guess first of all, I'd like to thank everyone and all of the efforts, the healthcare workers, our legislators who've really come together to address this situation. Really an example of really what's happening here today, tireless commitment, and really a community that's come together. To better serve our patients and community, OSF Healthcare has launched a digital solution. It's a chatbot that's called Claire. You can access this chatbot via our website, osfhealthcare.org. You can do that on your computer. You can also do it on your phone. The purpose of this is to help patients in two ways. One, to get access to information, and secondly, to help triage them. A lot of the conversation that's been earlier is about the importance of patients being able to understand where and how to navigate the health system and not to go directly to emergency departments. If patients reach out and complete the questions via use of Claire, she will help navigate the patients to the appropriate locations or the appropriate phone number so they can get information. We know it's a challenge for people in terms of understanding how to navigate complex health systems, so we think this is going to be a great solution moving forward for all of the communities that we're serving. And now I would like to turn it over to OSF's Chief Operating Officer and Regional CEO.
Thanks, Michelle. My name is Mike Cruz. As Michelle stated, I think it's a great opportunity to at least demonstrate some of the detailed work that Keith Knepp described earlier. You know, there's 52 counties that OSF Healthcare spans, and as a result of that, we have a lot of responsibilities to those communities to work very closely with the departments of public health and other institutions and medical centers and universities that we work in those communities with. As a result of that, Emergency Operations Command Center has been open for 2 weeks now. We meet on a daily basis. We have daily briefings. And each of the different operating units or the hospitals or medical centers have their independent emergent command centers that are open. And as a result of the pandemic response from the CDC, we have requirements to dictate what those surge capabilities are and how we activate those in times of emergency. So there's triggers that are built in that when they hit those triggers of being full or reaching certain severity of illness of patients that were being seen, we actually go into those surge capabilities. So from IT infrastructure to ventilators to staffing to housekeeping to transport to the ORs to elective versus non-elective procedures are all thrown into those surge capacity plans that are required to have on file. So we've had to activate those in prior endemic responses. Although this might be new for COVID-19, as you well recall, we've had multiple of these viral incidents and bacterial incidents in the past 20 years alone. So with that, more locally, we have the opportunity to respond, and I think we have to recognize the fact that when we have a large influx of patients, especially those that are sick, we will tax the system. And as a result of that, we will have restrictions. Keith had mentioned several. We're going to work closely with the community. It'd be ideal to have very similar restrictions so that the community understands they are the same. And those will be enforced, and they are very restrictive by design. So only those patients who really require to have a family member, so typically it'll be down to one visitor per patient, and they may actually be screened as well, and that might be required before they can enter the facility. And we might enter into an era where we're actually screening our own mission partners or employees before they're allowed to take care of patients. It's very restrictive. In addition, if you're non-patient-facing or patient-caring or non-employed, so think of students. So whether you're a pharmacy student, nurse, medical student, and on, you might not be allowed to be on campus if we should reach those areas of restriction. And that's critically important because a lot of those students are in class, and as a result of doing this clinical work, it impacts their ability to graduate, take tests, or finish their semester. So we take that seriously in making those decisions. But if we should come to that, we'll make that clear in announcing how that could be impacting the community. And once again, we'd work closely with Unity Point to recognize that, and also the College of Medicine, notifying Bradley and ICC if need be. We'll take those drastic efforts should that come to pass. In the meantime, we will continue to work closely with the Department of Public Health, and when patients become positive or persons under investigation, we'll have to respect the fact that we have to follow protocol in being transparent, and we have to respect the fact that those patients have to be notified by the Department of Public Health before we release that information, and we would not release any information that would violate the integrity of the system and the healthcare protection of their information of those individuals we're taking care of. And appreciate everyone for the help. It is a trying time, and we have a lot of resources. We have to use them to the best of our capability. And I think you've heard those details that we continue to work closely with other universities and local communities. Thank you.
So as Representative Spain mentioned, not only is our community served by 3 local health departments, a federally qualified health center of Heartland Health Centers, as well as Unity Point Health, OSF St. Francis Medical Center, but also we have a College of Medicine here. And with that, I'd like to introduce the interim dean for the region of UICOM, Dr. Ayer.
So as you have heard before, the University of Illinois College of Medicine in Peoria really values our collaboration and our commitment that we've been having with both the 2 large hospital systems to really provide care to our community at the time of this need of COVID-19. We've already put in place a lot of things, as you have probably heard from the university. We've adopted the principles of social distancing, and a lot of our students, starting Monday, have actually transitioned to online learning. And Dr. Cruz did talk about students in a clinical setting, and we've been working with both our hospital systems to ensure that the priority is really given to the health of the community in really changing the trajectory that we have of the transmission curve so that we have reduced number of COVID in the community and we can actually provide the care we need to the critically ill patient. And again, I would like to highlight and call out to the people that when you have symptoms of illness, whether it is fever or cough or cold, as much as it is mild, please make sure that you call your healthcare provider and let them know and follow the instructions that you get. And this is something we have been encouraging even our students to do and all members of the healthcare community to do as well. So I know these are really difficult and challenging times, but I think in the greater Peoria area, we are really lucky to have such strong health systems, a university, and a strong community, which can really come together to take care of our patients.
So with that, we will open it up for questions. Andy.
This man who was tested positive, could you please tell us when he first came to the clinic, and could you also maybe tell us where this clinic was?
Information specifically regarding the testing of the individual and the case of that can be directed to the Illinois Department of Public Health and their public information and department.
Can you tell us
this man had traveled outside the country recently?
Right now, we're currently investigating and working through his contacts. And with that, we don't eliminate anything such as travel history, whether it's abroad or local, domestic, excuse me, as well as relationship to other known contacts. So right now, we're still in investigation mode, but we're not ruling out any of those type of aspects.
Can you go into any more detail about, is this person elderly, things of that nature?
I can turn that over to Hillary Aggert.
The individual that lives in Woodford County that we are communicating with and investigating additional contacts, as Monica said, all we can say at this time is this person is in their 70s.
And then, for example, we've already heard from some viewers that the Willow Hill United Methodist Church in Germantown Hills has been shut down because of a confirmed case in their congregation. Can you talk about what the communication is like with people that may have come into contact with this individual?
We are in contact with our community partners, and as Amy Fox had stated, that there are situations within churches that they're evaluating, that we know that this individual lives within our community. There are definitely different situations going on, and that's why the investigation process is in play, but I can't speak any further to that until it's completed.
Are any of you aware of any other confirmed local cases?
We are not at this time.
As far as there's a lot of things, and every single person here has said the same thing over and over again because you're trying to hammer the point home. I get that. But what she just said, that people on social media are spreading stuff, they're passing stuff. What would you say? Here is your chance. You are live streaming this to talk to these people. People are claiming to know them. They're claiming that they touched him. They're claiming that they went to that church. On and on and on. I get why you can't say some of this stuff, but is there anything that you can say to us and to them to try to calm some of the fear?
We do understand that individuals in our community are at the point that they want to know if they had potential exposure, and like I mentioned before, we are trying to do our contact tracing to understand who might be at medium or high risk for this individual. In the general population at large, we would say that it is low risk, but we are still evaluating that in our investigation process.
Should anybody who would come in contact with this person self-isolate on their own?
Well, that's where we're still doing the investigation, so I can't speak directly to that, but that's why the community at large, we keep promoting to limit your access within the school systems, the churches, or place of worship, as well as any other large gathering scenarios to try to eliminate that risk.
But what about the folks who might have seen him last week? I mean, the point is there are folks out there who reached out, who were in touch with him prior to this announcement. What should they do?
And that's where our departments of public health are actually doing that contact tracing. So if an individual is identified as potentially having exposure, we're reaching out to them and following up individually as well with their healthcare providers.
So would I take that, ma'am, to mean that if I don't hear from you within two or three days, I am fine from this thing, or what?
Again, we're unaware at the moment, with the spread continuing across the state daily, we're continuing to do our efforts at the local level to do as much investigation as possible, work with our healthcare provider systems to identify those risks and reach out to those individuals.
This is a polling place. This is a polling place for the election. Are you guys going to move it?
In terms of the church that you're referring to in Germantown, that would be working with the Election Commission to discuss that. I did want to touch base about the social media and those information. Tomorrow there'll be at 5 o'clock a simulcast out of WTVP's offices, where we'll be offering up subject matter experts around the panel discussion to answer questions from the public in regards to COVID-19. I think a key thing to remember, and I think the administrator from Woodford County, Hillary Agger, really focused on, was the fact that because we now know, and I think all of us understand, that the cases are in our community, being self-aware and taking on that stance of social distancing and isolating, especially when we're symptomatic, is very important to, again, control the number of cases. We want to decrease having too many cases in a short amount of time. Again, flattening the curve, as the term is.
The Illinois Department of Public Health in their release this afternoon said a Woodford County resident in his 70s. Can you confirm that it is a male?
Yes, we can confirm that.
So yesterday we heard in Peoria County there had been 3 people tested. 2 had tested negative, 1 test was pending. Was this man the pending test?
No.
So can we say how many tests are currently out pending in Peoria, Tazewell, and Woodford counties at this time?
We don't have that information at the time of this conference.
Is that 1 test still pending then, the one in Peoria County?
It is.
Okay.
You mentioned that the test results are usually pretty quick, a day, so now it's been 2 days. Is there a reason why it's still pending?
It depends on the type of testing facility that's being utilized, whether it's a state lab or one of our private labs. And again, commercial labs are coming up more and more every day, and as this continues, we do want to reiterate that when it comes to testing, it is still prioritized, and you should really speak and call a healthcare provider prior to starting or looking for testing. I think Dr. Nebb made it very clear in understanding that we understand there's going to be a lot of concerns in our community, but really speaking to your healthcare provider is going to be the best resource you have. Okay, well, thank you so much.
All right, you just heard a lot of information there, first from the governor and then also from our local health officials. Again, both confirming today that there is a first confirmed case in central Illinois. It's in Woodford County. The Illinois Department of Public Health says that man is in his 70s. He is currently being isolated at this point and in recovery. Throughout the state of Illinois, 18 more cases since yesterday. That brings our total to 64 cases. Some 800 people throughout the state have now been tested, 1,600 samples. You heard there from the local health departments here within our area. Their recommendation, if you are thinking that you might be feeling some kind of symptoms, first they're saying don't go to the ER right away. They want to limit the amount that this could spread, particularly if you do have symptoms of the coronavirus. Instead, they're saying you need to call your local health provider. Call your doctor first. Speak with your doctor, and then upon their recommendation, go to your local health facility. That is where specimens will then be taken. Those specimens will be sent off to be tested. Right now, within the central Illinois area, you just heard from Monica Hendrickson, there is still 1 test that is pending in central Illinois, so we don't yet know the results from that at this point. There's a lot of other information that we're learning at this point as well. Governor Pritzker is filing for an extension for Medicaid under the national state of emergency that the president has issued just yesterday. We also understand that there is the first case in southern Illinois. This taking place at Sarah Bush Lincoln Health Center. Our sister station WCIA in Champaign reporting that a man went to the ER, was tested there, and tested positive. We don't know much more about that. Hospitals at this point are also taking precautions when it comes to going in response to COVID-19, now particularly that we have a positive case within central Illinois. You heard from Unity Point there. They are now restricting access for visitors to all essential visitors. And some of those people can include, if you might have a patient or loved one who is receiving end-of-life care, they said also childbirth and essential for a person's care. You also have to be healthy. So if you have any symptoms or they might perceive you to have symptoms, you heard there from a local health provider that they may turn you away. So they're really trying to make sure that the people who are the most vulnerable, those who are already in the hospital, and our elderly are able to remain safe and as far away from the virus as possible at this point. I know we have a reporter there that is at the scene. I think we're going to wait a little bit before we send it to him to kind of get a recap of that as well. But there are patients spanning right now 8 counties across the state of Illinois, all right, including in Woodford County, as we mentioned as well. And also the stressing of the importance of social distancing. Governor Pritzker spoke to that. Our local health providers spoke to that. There have been pushes to stop gatherings larger than 250 people throughout the state at this point. Obviously, schools have been canceled starting on Tuesday all the way in through March 30th, many of them going ahead and taking the day on Monday as well. But the idea that you are able to be somewhat of a distance from people, make sure that you're not potentially spreading the COVID-19 as much as possible. They're urging people to stay home. Stay home, especially also for young people. As the governor said, he wanted to make sure it was reiterated. Just because you're hearing that most of the people who are experiencing the worst of the symptoms are older people, the elderly, younger people, he's still saying stay at home as much as possible because you could be a carrier. All right, we have our own Matt Sheehan, who is there just after that press conference that you just heard, or if you're just joining with us, our local health officials with the Peoria City County Health Department and several hospitals and local leaders just spoke. We're going to send it to Matt Sheehan to kind of give a wrap up of what you heard there, Matt.
Well, Eugene, I heard a lot. We're here at the atrium for Unity Point Healthcare, and I'm here joined by Hillary Aggert from the Woodford County Health Department. Hillary, thank you for joining me. We just got out of a press conference with a lot of health officials. Hillary, can you just kind of go over the first case here in Woodford County?
We do have a confirmed case in Woodford County. That's all that I'm able to reveal, besides that it is a male in their 70s. And that we are communicating with this individual regularly, trying to take due diligence to understand who has potential exposure, looking at medium and high risk and potential testing to come.
And Hillary, you mentioned that this test, it came back positive yesterday, and you've kept good communication with him. Any kind of quick tips you have for our viewers out there that are watching right now who might be worried if they came into contact? What are some quick tips for anybody out there?
Well, we're continuing to do the investigation within our department, as well in collaboration with our partners in Peoria and Tazewell County, and also our healthcare community at large. So the guidance that I have for you right now is just take precautions, do not come into contact in large gatherings, try to isolate yourself within your home. If you can work from home, telecommuting, whatever that looks like in the future, and we do know that the schools will be closed starting next week.
And Hillary, there have been, other pandemics that have happened before, but has there really been anything like this that you've seen before in your health department?
There is a lot of unknowns. The last experience that I had was H1N1, but since flu continues to be a seasonal thing and strains and mutations come from that, we felt pretty confident, at least with the response that we had. Just coordinating with our partners, Illinois Department of Public Health, the Center for Disease Control, as well as our local community. We're just trying to make sure that we're understanding the guidance coming from the federal government to the state down to the local level, and with the potential exposures in our community, identifying those individuals and trying to work with their healthcare provider, as well as try to isolate those cases within their home and only the critically ill or those with immune-compromised illnesses to seek medical care.
And you just kind of mentioned that there are a lot of levels to this, from the federal, state, down to the counties. I mean, how is that communication going from here, Peoria, Tazewell, your Woodford County, to the state, to federal, like you said, with CDC or the WHO?
With the communication and all the planning that goes into place, we have been planning for situations like this pretty regularly as we do communicable disease surveillance within the health departments, and that is very key to this situation. It's just on a more extended level, just with all the unknowns at play and those affected.
Well, Hillary, that's all the questions I have for you. Really appreciate you joining us. Eugene, we're going to be kind of standing here talking to other people, so feel free to come back to us soon. But for now, like I said, I'm at the atrium for Unity Point Healthcare. Back to you.
All right, Matt, thank you so much. Some other things that we've learned here today as we are experiencing our first positive testing for the coronavirus for COVID-19 in Woodford County in central Illinois today. Also, in speaking about, again, the importance for people if you feel as though you might have symptoms, you've heard it so many times today from health professionals, from the governor, from the Illinois Department of Public Health, this is the time in which you would call your doctor, call your local health provider, and allow for them to give you a recommendation to go to a health facility so then you can have a specimen taken and then a test. Also, OSF talked about it today. They have uploaded a digital triage. So this is an ability for you to call and speak with, they call it Claire, this virtual assistant to kind of help you diagnose and see if you're experiencing any of the symptoms for the coronavirus, for COVID-19, and then be recommended for the following steps. You can find that information on how you can get connected with that. That's on our website right now, CIPROUD.com. Again, this person, a man in his 70s in Woodford County, the person who was overseeing Hillary Haggard with Woodford County Health Department, couldn't give us a lot of details about the individual at this point, other than that person has been isolated and they are in recovery. And also that the region is taking steps at this point also to boost testing efforts. They're also, as part of the protocol for sending this to the Illinois Department of Public Health, they're also investigating and reaching out to people who may have had contact with this individual so that they can see if there's a possibility that the COVID-19 virus has spread within the county or people in which this person has come in contact with. And overall in the state of Illinois, we heard earlier from the Illinois Department of Public Health that about 30% of the cases are from travel, and another third of those are from being in contact with somebody who has already tested positive for the virus at this point. The remaining cases are still unclear, and the Illinois Department of Public Health director today saying that as the cases come out, more testing is able to be done, that possibly they'll have a better understanding of the containment efforts throughout the state for this. But I want to make sure to reiterate, you've heard it a lot of times here tonight as well, still not a time to panic. The time for preparation. We've had health professionals onto our program, and we've talked to them repeatedly and saying this is a time, again, social distancing, washing your hands, taking all the necessary precautions that you can to make sure you are limiting exposure, that this doesn't spread, and staying home as much as possible so that the hospitals as well are not overburdened for the medical professionals. Right now they have a lot that they're trying to accomplish. They're trying to really handle a lot as there's so much information that is new and involving at this point. So they don't want people to rush to the hospital. Not a time to panic. Call your doctor, and then the available steps will take place after that. We're going to send it back to Matt Sheehan. He has somebody else that I believe he's going to speak with us now about. It's going to be State Representative Ryan Spain out of Peoria. Matt?
Yes, Eugene, I'm joined by Representative Ryan Spain here. Mr. Spain, thank you for joining us. You just mentioned kind of in the press conference here a little bit about, if you've got an organization or a group of people that needs a little bit of help with maybe meals, food, stuff like that. What can they do?
Right. Well, thank you. We have such a generous community. We anticipate that offers of generosity will be pouring in, and we want to be able to coordinate those and really perform the work of matchmaking to the best of our ability for the region. So we are using our regional information service 211. So dial 211 on your phone. You'll be connected with a call center that will provide information. If you're looking to make a donation to help your community, call 211. If you're looking for help and you're in need of certain things at an organizational level, a school or a community group, we will also collect your information through 211, and then we'll use my legislative office to coordinate and hopefully offer some of the matchmaking services for both sides of that equation.
From a government standpoint, talk about kind of where we are at with a bill for coronavirus relief.
Well, I think you see action taking place at the federal level, which is very important. There was an initial appropriation, I think $8 billion, supplemental agreement from Congress that is just, I think, getting voted on today. That I know the President will sign. So we need an overwhelming federal response. I think that's important. On the state level, where I work, we have declared a disaster proclamation for the state of Illinois. That makes funding available from our statewide and local emergency management perspective. And then we also know that there will be assistance needed from the federal level. So I'm looking forward to, I support the action that Congress is taking. I think that's important, and we'll put it to important and good use here in Central Illinois.
All right, anything else you think, viewers at home who are watching now kind of need to know about what you guys are doing?
I would just say I want everyone to be calm. I understand that this is a period of great anxiety, and I think we're all feeling that same way, but we're all in this together, and we will get through it. We need everyone to be smart. We need everyone to make some sacrifices. That means staying home. That means trying to keep yourself well. Even if you feel really well, we don't want you out unknowingly spreading transmission to others that may be vulnerable. But we have one of the world's greatest healthcare delivery systems here in Central Illinois. We're very well equipped to deal with this, but there will be some sacrifice for the next coming weeks, and we'll all work together through that.
Sure. Well, Ryan, thank you for joining me again. Hope you guys got all that information. If you guys need help, call his office. You can find the office number online, as well as, you said 211, right?
211.
Okay, great. So give them a call if you guys need help. Eugene, we'll stay here, like I said earlier, kind of keep talking to people. I'm going to throw it back to you for now.
All right, Matt, thank you very much. You heard it from Representative Ryan Spain. He's asking for people to stay calm, stay vigilant, and for all of us to be in this together. Again, the first confirmed case of the coronavirus, COVID-19 in Central Illinois, reported today, tested positive on Friday. That man in his 70s in Woodford County. There's complete coverage on our website, CIPROUD.com. All you have to do is click on the coronavirus tab that is located there under the news tab. I think also something important to note, no confirmed deaths in the state this time as well. Thanks for joining us for this special edition of WMBD News. We'll be back at 6 o'clock.